I'm really excited to introduce our speaker. Dr. Adam Harrison is a physician, lawyer, and a leadership coach who, as a result of his personal experiences, specializes in confidence and mindset coaching for physicians and other professionals who have been on the receiving end of workplace bullying. Now, as a former medical director, Adam also works with medical leaders on developing kind leadership cultures based on the compassionate, servant, and inclusive leadership model paradigms. The underpinning philosophy to both his workplace bullying and replacing toxic cultures with kind leadership work is mental and physical well-being. Dr. Harrison strongly believes in doing work aligned with his core values of honesty, justice, gratitude, love, and humor. So welcome, Dr. Harrison. We're so excited to talk with you today and learn more about your work and what the message that you have for leaders today. I'm going to take a step back and let you have the stage, but just let me know if you need any help and I'll be right here.
Thank you. Thanks so much, Meg. Thanks for that lovely introduction. It's lovely to meet you. And thank you to Power to Fly for having me back. Really, really kind of you. So today I'm going to be, I suppose, speaking to the hybrid working side of the theme of the summit. Because it kind of occurred to me and some organizations I was working with that when people were returning or being asked to return to work following the regulations being relaxed after the pandemic, and some employers were quite keen to get their workforce back into the office or back into the workplace, that was creating quite a lot of anxiety for some of the employees. So just see if I can get this to share. Oh, right, yeah. So I pressed the wrong button now. Okay, so this really is around managers and leaders, how to talk to your team if they're anxious about returning to the office or even kind of working in that hybrid way when perhaps they'd rather work remotely entirely. There's quite a lot of content, so it's going to be a bit of a sprint through it, so apologies for that, but anyone can reach out to me and I can go through this with them in more detail if they wish. So thanks for coming. Aims and objectives are to discuss what anxiety is and how it might be affecting your colleagues already, how to spot features of anxiety or elicit them through gentle inquiry, leaning into difficult conversations, like how to do that and why we would want to do that, how to frame conversations around returning to work, especially for those employees where there's a kind of root of anxiety, finding ways to support your colleagues, and reframing personal vulnerability as a leader and a manager as a strength rather than a weakness. And just quickly about myself, as you've said, I'm a physician. I've been a physician for 21 and a half years. I've been a lawyer since 2014 and a leadership and executive coach since 2020. And this is a very important subject to me. I am, as you said, very interested in workplace bullying, and I think there's a bit of cause and effect here in terms of some people not wanting to return to the communal office because of bullying. So that's where my interest came out of it. So I help organizations and their managers and leaders with this kind of communication challenge, and I've done so a few times. So, all right. So what is anxiety and how might it be affecting your colleagues already? And a lot of you will know a lot about anxiety already, may suffer with anxiety, but it's perfectly normal and it exists on the spectrum. And features can include, for example, feeling nervous, feeling on edge, not being able to stop worrying about things, having difficulty relaxing, being very physically restless, being unable to keep still, being easily annoyed or irritable, feeling afraid or feeling as if something awful will happen, that kind of feeling of impending doom we talk about in medical arenas. And it's really only a problem if it's invasive or pervasive and it's affecting your everyday functioning, adversely affecting your everyday functioning, interactions with people, your colleagues and partners and friends and relatives, and or preventing you from reaching your goals, which as a coach, is very close to my heart. So I mean, we often use the word anxiety fairly loosely in kind of everyday parlance, and we liken it to the way we speak about stress, but they are different. Anxiety is perfectly normal. It's the brain's way of responding to threats or danger. So, for example, in Neanderthal days, you went out of the cave and you went to hunt and gather, and you might have heard a rustle in the bushes, and then you saw the glint of a saber-toothed tiger's fangs. And we needed a certain amount of anxiety to propel us into action, to kind of run back to the cave and get back to safety. And actually, even in our everyday working life nowadays, we need anxiety to increase our productivity. So a lot of you will have heard of the Yerkes-Dobson curve, which is performance on the y-axis and stress on the x-axis. And there's almost a directly proportional relationship between your performance improving with increases in stress until it gets to a plateau at the top of this sort of kind of bell-shaped curve. And that's where it's optimal amounts of stress for your maximal performance. But then when the stress increases beyond that point, your performance starts to slip off. So it's good up to a point. And for some people, anxiety can be very overwhelming and produce some of the symptoms and signs that I've just mentioned. And at one side of the spectrum, people may have anxiety disorders, such as generalized anxiety disorder, social anxieties, phobias, obsessive compulsive disorder, PTSD, etc. So how can you spot features of anxiety or, excuse me, elicit them through gentle inquiry? So just kind of like very kind of subtly asking about things. And I really, I'm talking about in the workplace here. So you might notice your team members or colleagues having trouble concentrating, displaying excessive levels of perfectionism, being withdrawn in the workplace and less social with their colleagues, working late all the time, maybe because they're anxious about having, kind of missed something and they're going over and over and over things. Missing deadlines and being tired all the time. And that may be coming from working late and going to bed late because they're staying up late, trying to get things done right because they're anxious. Procrastination, I certainly experience that when I've got stuff that I really need to do because of my perfectionist traits. It's like, well, I'm going to keep deferring it until I feel like I can do it perfectly. Presenteeism is something that is seen in a lot of professionals, certainly see it a lot in the medical profession, people turning up to work when really they shouldn't be at work because they're not well for whatever reason. I don't necessarily mean about anxiety, but, maybe they have a chest infection or something, and they just turn up anyway because they feel they've got a duty of care to their patients, they've got a duty of care to their colleagues, they feel guilty if they don't turn up, and all of this is kind of tied in with anxiety as well. Reduced participation, that's in kind of group activities. Again, that ties in with the social withdrawal. Missing meals. You can lose your appetite with things like depression and anxiety, being easily overwhelmed and being stressed all the time. But the problem is that there are certain features that people might spot that they will think they will attribute them to things like laziness or disorganization when actually it's anxiety. So a lot of these features can present in people with anxiety, but they are mistaken for something else. So, lack of interest in the job. They're just not interested. That's why they're not working hard. They're not cut out for the role. This isn't for them. They just need to toughen up. They're not resilient enough. Or they're lacking motivation. They just can't engage in their work. Or they clearly don't want to be promoted. They're quite satisfied being where they are. And all of these are things that you see with anxiety and other things like neurodiverse people as well. So it's really important then to proactively lean into these difficult conversations, and they are difficult, they are challenging, but why would we want to do that? Why would we want to speak to colleagues and say, well, why are you anxious about coming back into the office or something like that? There are lots of great benefits to doing this. It can foster better relationships between managers and leaders and their team. You're obviously showing an interest in your team if you're having these difficult conversations with them. It can enhance belonging, so they feel like they're not being excluded just because they are coming across as being lazy or disorganized when actually it's due to anxiety. And it cultivates trust. So it's another opportunity for a leader or manager to have a conversation and get to know their team members. And we'll talk a little bit later on about how leaders and managers can share some of themselves and their experiences in private life with their colleagues who are anxious. But there are obviously potential drawbacks. Some of the things that someone might tell you about, like I mentioned, bullying, workplace bullying, and you say, well, actually, they may not want to admit it, but if they do, that may kind of trigger the person who's speaking to them, because they may have been bullied in the workplace in the past themselves. Or you may feel vulnerable as a manager or a colleague having these conversations. We're not really trained for these, you know. I mean, I'm used to speaking to anxious people because it's a common mental health condition, and I'm a doctor, but most people don't have the training that I have, so it's quite scary. And then there's that fear of opening the floodgates. Well, actually, you know, do I really want to hear all the gory details? Do I want them to tell me too much? You know, I'm a bit afraid of that. But there are ways that we can do this that will lead to success. And I'm just going to go through a framework now. So the first thing would be the invitation, simply inviting your colleague to have a conversation with you. You've noticed something is maybe, you know, maybe not everything is good in the workplace, or with the quality of their work, or their work productivity or whatever. So, you know, you want to invite them in. But give the meeting a neutral title. So rather than it being a sort of performance management type thing, you know, your workload is, you know, is fine, but you're not keeping up with it, or your quality of your work is rubbish, you know, keep it really kind and just have it as a bland, you know, return to the office check-in meeting. And just be very flexible and ensure that it's convenient for them, so that the time and the date suits them. That, you know, they haven't kind of like got a doctor's appointment already that day or something like that, and you're saying, well, we can't have it any other time, it has to be then. And obviously that's just going to exacerbate their anxiety if that's what they're experiencing. So the housekeeping, setting up the meeting, have it in a neutral, quiet, well-lit, warm, private space, not one of these offices that has all glass walls, and, you know, someone walking down the corridor can be sort of rubbernecking as they're going, oh, what's Adam doing in with the boss? You know, why is he in trouble? Have a jug of water and some glasses and a box of tissues available. Put your mobile phone on silent. All those kinds of things. And then the meeting itself. So the first thing will be to build rapport. And so it's essentially just being kind. Just do some really basic things. Offer to make them a drink, or if you have a drink dispenser in the corridor, you know, get them a hot drink. Be empathic, and by that I mean not just noticing, like being in tune with their emotions and noticing them, but noticing, being mindful of your reactions to their emotions. And demonstrate empathy. So what do I mean by that? So displaying empathy. So make sure that the speaker, your colleague, understands that you're able to recognize their emotions and share their feelings. By showing compassion rather than just feeling it, you're able to connect with the speaker and begin establishing a sense of mutual trust. So, for example, you could say something like, I'm so sorry that you're dealing with this problem. Let's figure out some ways that I can help you. And then there's being actively compassionate. So what does that mean, rather than just being compassionate? So being sensitive to and proactively helping to alleviate their anxiety by considering both the cause and whether you can do anything about it. For example, granting a request by the colleague to continue working from home because they're caring for an elderly relative. They have caring responsibilities, and it's like, well, we can accommodate that, because you know, as long as your work productivity is okay, then we don't have any issue with it. So then some basic communication skills tips. So active listening. Firstly, non-verbal techniques. So nodding plus or minus smiling. So offering the speaker a few simple nods shows you understand what they're saying. A nod is a helpful, supportive cue, doesn't necessarily communicate that you agree with them, only that you're able to understand what they're saying and process the meaning of their message. So that's obviously a non-verbal thing. And smiling is like a nod. A small smile encourages a speaker to continue. However, unlike a nod, it communicates that you agree with their message or you're happy with what they're saying. So a smile can take the place of a short verbal affirmation like, yes, in helping to diffuse any tension and ensure the speaker feels comfortable. So if things feel like they're getting a little tense, kind of break that ice a little bit with a smile, and it makes the other person actually want to smile. And it's good for endorphins and dopamine and oxytocin levels. Maintaining eye contact, always keep your eyes on the speaker and avoid looking at other people or objects in the room. Just be sure to keep your gaze natural, using nods and smiles to ensure you're encouraging them rather than making the speaker feel intimidated or uneasy. So obviously it goes without saying, no need to stare at them. Keep everything natural, and avoid distracted movements. Being still can communicate focus. To do this, try and avoid movements like glancing at your watch or your phone, audibly sighing, doodling, or tapping a pen. And that may sound like teaching your grandmother to suck eggs, but believe me, I've been in meetings where people have shown complete lack of interest, tapping their pen on the desk and so on. And then the other part of active listening, verbal techniques. So using open questions wherever possible. So ask questions that show you've gathered the essence of what they've shared and which guide them into sharing additional information. So these are questions that can't be answered with a simple yes or no. So, for example, you're right, the onboarding procedure could use some updating. What changes would you want to make to the process over the next 6 months? Then they can't say yes or no to that question. They have to come up with some suggestions. Proactively using silence or pauses. A lot of us, me included, it still takes a lot of getting used to of being comfortable with silence, and we always want to fill that silence. Excuse me, but actually that pause is giving the speaker the opportunity to think about what they want to say. So you're not constantly kind of like jumping in and preventing them from having that time to think. Paraphrasing, so essentially summarizing the main points of the message that the speaker shared to show that you fully understand their meaning. That also gives the speaker the opportunity to clarify vague information or expand on their message. So for example, so what I'm hearing you saying is your current content management system no longer meets your team's technical needs because it doesn't support large video files. Is that right? And then you're giving the opportunity to say, no, I think you got that bit confused or whatever. Use short verbal affirmations. I mentioned that before. A smile can take the place of a short verbal affirmation, but short positive statements will help the speaker feel more comfortable and, and show that you're engaged and you've been able to process the information that they've given you. Small verbal affirmations help you to continue the conversation without interrupting the speaker or disrupting their flow. For example, I understand, I see, yes, that makes sense, or, I agree. Don't be afraid to share similar experiences. This goes back to what I said before about the kind of the vulnerability as well, showing your vulnerability, a la Dr. Brené Brown. So discussing comparable situations will not only show the speaker that you've successfully interpreted their message, but it can also assist in building relationships. If the speaker shared a problem, providing input from how you solve similar challenges is very valuable. You know, we all have a wealth of experience behind us, so why not share some of the ways that we've got through certain situations. For example, I had a tough time getting started with this program too, but it does get much easier. After just a few weeks, I felt completely comfortable using all its features. And then you've reassured the speaker and you've put in their mind that in a few weeks they'll be comfortable using it too. And this humanizes you. It makes your colleagues realize that you're human too, and there are commonalities there, so they can relate to you. And through this comes trust. And just going back to vulnerability, in her book, Daring Greatly, Brené Brown, a research professor in social work at the University of Houston, describes vulnerability as uncertainty, risk, and emotional exposure. It's that unstable feeling we get when we step out of our comfort zone or do something that forces us to loosen control. But her book debunks some myths about vulnerability, the most popular being that vulnerability is a sign of weakness. When we think of times that we felt vulnerable or emotionally exposed, we're actually recalling times of great courage. So, you know, I would advocate anyone reading her books and looking up her stuff. One of her TED Talks, The Power of Vulnerability, is one of the top 5 most viewed TED Talks in the world, with over 50 million views. And she is the first academic to ever have filmed a lecture on Netflix. Other platforms are available. So the carrying on with the framework, the nitty gritty of it. So what the kind of mechanics of it. So Start by thanking them for coming. That's really important. Advise them that the conversation is confidential. Okay, that is, nothing is going to go outside of the room. Acknowledge that returning to the office has been difficult for some people, including yourself, if that is the case. And again, you're sharing and showing some vulnerability there. Begin the the inquiry stage with an open question. For example, how are you feeling today? And they can't answer yes or no to that. They have to kind of start talking, and then you can follow on from that. You may need to switch to a few closed questions to identify the specific issue. So especially if it might be quite a complex thing that may not just lend itself to an open, monologue that follows from an open question. So they might have a sick parent or grandparent or something. But then hearing this gives you the opportunity to anticipate their future needs to make it easier for them. So, do you think you might need to be working from home 4 days a week rather than 2 or rather than 5 or whatever? And ask their opinion. It's really important to see where they're coming from. So, for example, are there any things you have thought of that might make it easier for you? Are there any other people that can help you, or are there any that are getting in your way? Can you think of any resources that we can provide to help you manage this yourself? Are there any things that I could enable to make these changes happen for you? What outcome are you looking for? And what sort of time frame do you feel you need to achieve this? What would a successful resolution look like to you? How would it feel? How would it signify to you that this problem has gone? Moving forward, how would you like to feel about this issue in however many weeks, 4 weeks, 8 weeks, 12 weeks, 3 months, 6 months? And you can set some goals. This is the kind of coaching side of it. Set SMART goals: specific, measurable, achievable, realistic, timely, and discuss the use of tiny habits. So Professor BJ Fogg talks all about tiny habits, which is like very, very small, kind of bite-sized chunk, baby step goals, essentially, that are kind of like very small, actionable goals that as you achieve them, you're working towards an overall goal. And end by arranging a follow-up conversation. And again, thank them for coming and thank them for their candor. But there might be some common problems that you might experience in having these conversations. And this is what kind of makes it quite scary, really. So, for example, you ask them how they're feeling and they reply, "I'm fine," and just leave it at that. But you suspect they're not fine. So then you might try opening up about yourself. Talk about how you're feeling. It's not about you, but we're trying to, we're trying to get this process moving along. So this is when, if you talk about yourself, it might encourage them to talk about themselves. Reiterate the confidentiality of the meeting, because that may be why they're holding back. Advise them there are lots of ways the company can help them if they do have any concerns, and arrange a future meeting. In the interim, they will have thought, oh, they were really kind. I think I do trust them, actually. I think when I next meet, I'll be able to open up more, and hopefully they will next time. I suppose people are also worried about the colleague starts talking, but then they become overcome with emotion and start crying. And that's really, really difficult. It's difficult for doctors to deal with this kind of thing as well. But just acknowledge the emotion by saying, "I can see you're upset and I'm so sorry if I'm the cause of this." Pass them the tissues and say, "Please take your time. We can continue when you feel ready, or we can meet again another time. Really don't mind." And then when they're calmer, ask them, "Is there anything I can do to help you right now? And then, are you happy to continue now, or would you rather meet another time?" Then you have colleagues who are really, really happy to open up and start disclosing lots of information. They're really, really happy. In fact, they won't stop. The floodgates open and you begin to feel overwhelmed. How do you deal with that? So try to interrupt them gently at an appropriate juncture, saying, I'm so sorry to interrupt you, but thank them for sharing such valuable information. Advise them it's a lot of information to process in one meeting, and suggest breaking it down into manageable chunks to tackle it over more than one session, perhaps. Help them compose a list of topics that you can go through and plan over a certain number of sessions. But if the information is not just voluminous, but also not appropriate for you to deal with, suggest that they arrange to see the company psychologist, for example, if you have one. And some of the personal information they disclose makes you feel uncomfortable. Again, you have to acknowledge it. You have to lead with honesty. Acknowledge that the discussion is making you feel slightly uncomfortable. Advise them that you don't think you're the most appropriate person for them to speak to about this issue or challenge. Instead, signpost them again to the company a psychologist, but inform them that they have your full support moving forward. What about if the chat starts to go awry? They get agitated, overly defensive, possibly even aggressive. They use phrases like, it's none of your business, that's private. You've got no right to ask me that. I know my rights, all this kind of stuff. Again, acknowledge their feelings. You appear to be upset. I'm so sorry if I'm the cause of this. I didn't mean to pry. Of course, you don't have to disclose anything to me that makes you feel uncomfortable, etc. Again, offer to reschedule the meeting, or maybe they'd like to arrange a meeting with a different manager. Maybe it's you that's triggered them because they don't like you for some reason or whatever. But advise them that they have your full support moving forward either way. And then finally, you start to feel triggered by this conversation that you're having with them. You might feel angry, you might feel upset by the conversation, and you need to acknowledge your feelings and say, I'm so sorry, but I'm finding this conversation a little upsetting. Don't say that it's angering you if it is. And again, arrange for them to speak to a different manager, but tell them that they have your full support moving forward. And almost done now. So finding realistic ways to support your team. They have to be realistic. You have to be looking after yourself. Can you take this on? Do you have the bandwidth for this? You can't pour from an empty cup. If you're close to burnout, is taking on someone else's kind of issues like this just going to tip you over the edge? And if you can't help, what support services can you as a manager signpost them to? And it's important to find these out from your organization. And helping individuals find solutions themselves. And if not, considering whether you have the power or resources to help them. And again, if not, what support service can you signpost them to? And that's, rather than kind of like, spoon feeding people, helping them find solutions themselves is very empowering and liberating for them. And finally, reframing personal vulnerability as a strength and not a weakness. Back to Dr. Brené Brown, her model of vulnerability. It's got nothing to do with oversharing at every given opportunity. That's what people worry about with the vulnerability. And sort of coming across as if you're looking for sympathy or the attention's coming onto you is not a very productive motivator for a leader to sort of demonstrate. Focusing attention on you rather than the speaker, and you're trying to find out what's going on with them. So the ideal motivation for vulnerability is the chance to be real with yourself, and in the process, you open up an opportunity for other people to identify with you. So in summary, thank them for coming, advise them about confidentiality, acknowledge that return to the office has been difficult for some people, begin with an open question, switch to closed questions if necessary, move on to some coaching questions. What can you do? Who else is helping or hindering? How can I enable you to help yourself, etc.? What outcome do they want and in what time frame? What would success look like to them? What SMART goals, plus or minus tiny habits, can we put in place to ensure progress is going to be made? Arrange follow-up conversation, and again, thank them for coming and for helping you to help them. So I think we've been through what anxiety is and how it might be affecting your colleagues, how to spot the features of anxiety, how to lean into difficult conversations, how to frame conversations in this way, finding ways to support your teammates, and reframing personal vulnerability as a strength, not a weakness. Thank you so much for your time and attention. There's all my social media stuff. And there's something in the chat, Meg. I didn't have time as always.
Yeah, I know we're gonna get cut off on the live stream because it's set on a timer, but just in case we will go make sure that we have the full recording is what we publish in coming weeks. But I just want to tell you, there was a ton of interest in the chat. People want to know if they can download these slides. A lot of people saying that they want to watch it a few times because they're finding this very valuable. So if you are listening to the recording, it will be published. We did have a really great question, and again, because we're already cut off, I do just want to get to this one if you don't mind.
Yeah, of course. I'm sorry. Yeah.
So Vicky had said, this comprehensive information step by step is so helpful and important. I wish all managers could experience your presentation because many need assistance on how to connect on a human level. The widespread view that showing empathy and vulnerability is a weakness definitely persists. Do you find that modeling that vulnerability and weakness really carries a lot of weight with the people that you talk to, or do you think that kind of modeling behavior greatly depends on your perceived influence or your place within the organization?
If you're talking about me, I hope that when I'm talking to people and telling them how important and valuable showing your vulnerability is, will have some impact on them, that they will kind of over the course of the workshop or whatever work we're doing together will kind of have that impact on them. But certainly speak mainly to medicine, and I think most professions are the same, that people do model on what their seniors are, because they look, if you look at your attendings in surgery, for example, and you're a resident and you're looking at them saying, I want to be them one day. To become them, I have to behave exactly how they've behaved. And this leads to all sorts of problems. It leads to a lot of sort of workplace bullying and so on. So modeling is really, really key. We do need to get to the upper echelons of organizations and show them that kind leadership is the way forward, and not just because it makes their employees happier and healthier, but because actually it increases kind of the profit margins and things for companies, because clients and patients and stuff are happier if your employees are happier. It just makes sense on every single level, and you just think, why is not everyone not doing this, and why haven't they been doing this forever?
Which is bonkers, right? Because like you're talking about people that, granted, I mean, it's not like the workforce is entirely composed of boomers and above anymore, but you're talking by and large about a lot of people that completely bought theories that are very similar. I mean, like Reaganomics was literally trickle down. Like that was supposed to be the form of it. So if people can get on board with it when it comes to dollars and cents, it's not a hard concept to think about in terms of modeling the behavior that you want to trickle down through the organization. I love the way you framed that. Thank you.
It's really scary. The number of young doctors who are, they're not the most junior, but they're in the kind of middle grade level, who are just modeling themselves on the seniors, who are maybe only in their late 40s, but they've learned from people who have since retired.
Yes.
And so it's still kind of imprinting on them at every generation. So we need to get in from I think a top down and a bottom up approach.
Oh yes, 100%. I mean, it's kind of the same idea at work as, the attitude of like, well, you have to pay your dues. Okay, there are some careers where that's valuable, and these are the dues that you have to pay, and everybody goes through them, and that's fine. But just because those are the dues you paid, it doesn't necessarily mean that's a good thing to keep moving forward.
Oh my goodness, no. Again, it just leads.
I feel like I'm giving you agita with these comments.
No, I'm not getting triggered, don't worry. But I'm just thinking of all these situations that I've come across where, it's a bit like, as you say, well, I've been through it, so they've got to go through it too. But then when these people get to the top, like international medical graduates or female medical graduates or whatever, and they become attendings, there we go. Finished.
So sorry.
That's all right. They get above the glass ceiling and then they close the hatch. It's just, I don't get it.
You got to have that pull up mentality along with, that, like you said, top down and bottom up. I think that's wonderful. Yeah.
Totally.
All right. We are at time. I want to say thank you for taking a couple extra minutes out of your schedule to spend with us.
Not at all. No, my pleasure.
This session was really, really great. And honestly, I'm a little bit glad that I didn't moderate with you, because I was able to like sit back and really be present and listen to what you're saying. And I completely agree with a lot of our commenters. I'm going to definitely be rewatching this recording at least once or twice over the weekend. So thank you so much for bringing such an impactful message to our group. We're so lucky to have had you here today. Thank you.
No, thank you for looking after me, Megan. Thank you for bringing me back. And I've loved it. I've really enjoyed writing the talk and delivering it. Thank you.
Heck yeah. We can't wait to have you back again.
Awesome.
All right. Have a wonderful rest of your day.
Thank you.
And we will see you on our next event. Thanks so much.
Awesome. Thank you. Cheers, Meg. Take care.
You too.
Bye.
Bye.
Bye.